there was a clip of Ted Kennedy in the early 80s making a speech saying we do this wrong, we pay fee for services instead of pool payments. So, you know, he was working on this for a long time. If it were easy, it would have been done sooner. Having said that, you know, we ration stuff now. The people with pre-existing conditions aren't covered on insurance. A lot of, you know, I've always said my health care is great until I need it. You know, if you're sick or you realize that you're only covered for 3 payments, or you're, we make those decisions now. We just don't want to acknowledge it. And I do think we're going to have some tough discussions about what it costs and how we are going to pay for it. Nobody wants to deny anybody health care, but you can't just, without anybody being responsible for what the cost is, continue to say, I use this example of my husband and his sore foot from, I think he has a pinched nerve or something, I don't know what it's from, but he goes to his primary care doctor, which is, I don't know what it is, I'll send you to a specialist. Well, I don't know what it is either, let's do an MRI, let's do all these tests. The tests are done. Well, I don't know, we can't see anything, we'll send you to a physical therapist. All of this is reimbursed, and meanwhile his foot still hurts. And so, you know, he comes back and he doesn't know what any of this has cost, but no one has really owned the problem, and he still has the problem. Now, I use that as a sort of a lighthearted example because his foot will get better, no doubt. But in another system, the primary care physician would say, let's really get to the root of this and let's figure out what will work and what won't before we send you on this, you know, go here, go here, go here. And that's why the system is inefficient, and that's why it costs so much. And I'm not sure that this bill gets at that, because it's even with 2,000 pages. It's trying to solve a problem that's just grown up with huge, maybe unreasonable expectations of what Americans can and do get. But we need to do global payments. We need to have more focus on primary care prevention, not just on you get sick, you go, let's do 6 tests and see what it is. And I think that the role of community health center, more prevention, is going to play a huge role in identifying sooner major health drivers, like diabetes. We don't really do much around some of these chronic diseases that are becoming huge, huge cost drivers, particularly as people get older.
That idea of unrealistic expectations also goes to the Oregon governor. He says that there's never going to be any solution to the healthcare problem we have until we get used to the idea that we can't have everything we want.
Right. I agree with that. We have to be reasonable about that.
So how do you go along with that issue is something that you know hospitals like QMC here in Quincy is facing. The government reimbursement continues to drop as how much money they need to cover for services. The number of community hospitals that disproportionate share hospitals continues to grow, and they're filing suit against the state, which in your current capacity you probably have to deal with at some point. But it's an issue for the federal government too.
Sure.
So what can the federal government do? I certainly, I talked to the CEO of Quincy Medical today, and you could tell he's nervous about what shoe is going to drop when this healthcare reform bill gets passed. Things are bad now, or are they going to get worse? What kind of solutions do you think can Congress do to fix it?
Well, I think, you've identified exactly the problem here in Massachusetts, as we've gotten everybody insured, but now you have an imbalance in terms of who gets reimbursed for what, because the negotiating cloud is different depending on where you were and what the size of. And so if we are talking about, making this fair and cutting costs so that reimbursements will be fair and putting the focus on, and we're going to need a Quincy hospital, we're going to need the ability to have more primary care, more physician. I'm not sure where primary physicians are going to come from, and we need to think about that as we look at who's going to be going to medical school, what incentives are we going to provide for them to do something other than go to plastic surgery, where all the money is these days. That's just because that's happened. And by the way, doctors agree with this. I think doctors, unfortunately, have been left out of this process because it is, healthcare, it's the insurance companies and sometimes the big pharmaceutical companies, the big hospitals, teaching hospitals that are driving this. But, the doctors, and let's take Quincy Hospital, if they want to provide for good quality health care, they need to have a little more equity in terms of what the reimbursement rates are going to be. And until we start getting some transparency on how that whole process works, we're not going to resolve that problem. That is tough to do at a national level, and it's tough to do all at once. you know, and that's why I do think folks in Massachusetts are ahead of the game.